All right, so we're back with the Hawaii lays, the pineapple sunglasses, and we're ready for our last panel of the day. And then we're going to go into breakout networking sessions. So excellent. So our next panel is all about prosthetic eyes. And our first speaker is from the Toronto area. And many of you who live in the Toronto area where we're treated at Sick Kids know Matthew Milne, and he is going to start our session. So I'm going to turn it over to Matthew. Thank you for being here.
World Eye Hope and the Retinoblastoma Society today to inviting me to speak to you, whether it's the morning, the afternoon, or the evening, wherever it is. My name is Matthew Milne, and today I'll be speaking about the role of the ocularist in the retinoblastoma patient journey. And I'm part of the Hospital for Sick Children in Toronto, Canada. So the decision to nucleate an eye is an emotional and difficult one for everyone involved to make. For parents, one of the primary questions after this decision is made is, what will my child look like, or what will my child look like after this procedure? And involving an ocularist in this discussion can bring solutions and support to parents early in this journey. The best outcome is when we partner with both the parents and the surgical team to develop a custom ocular prosthesis for the child. And at the completion of this process, parents often remark that they see their child whole again, giving the family a sense of normality after an incredibly challenging diagnosis. So the first part I want to talk about is the relationship. The relationship between the ocularist, the child, and the parent should always be based on open communication, respect, and trust. That's something that you build over time. When first meeting a family in my clinic, I always like to provide some time for the child to play, to create a sense of familiarity with the space. Reason being is children de-stress through new situations through active play, toys, games, drawings, things like that. Also, with the time of play is a great opportunity to answer questions in a non-formal space. So you can answer, kids will come up with questions organically, parents the same thing, and you can answer them as they go along. And then finally, and one of the most important points of this whole relationship is always speaking to the child as well as the parents. You want to involve the child as much as possible with the questions and answers wherever you can, and let them kind of drive part of the conversation as well. There's a play area in my office. I always have kind of games or toys, cars, you name it, to have kids play. And that way they can kind of have their own little space that they can set up and do. So it's not as scary as having a big patient chair that they have to sit in. They can kind of move around a little bit as well, and it lets them kind of get used to the space as they go. So when we first start this process, we do a fitting under anesthesia, and at the Hospital for Sick Children, we normally do it 6 weeks after the procedure during the follow-up from the enucleation process. Now, we normally do these procedures for children up to 4 years old, and really it's because of cooperation difficulties when you're first doing that fitting. The other good parts about a prosthetic fitting under anesthesia is allows myself to examine the anophthalmic socket, and allows for full cooperation during the fitting procedure, and it really creates no discomfort for the patient during the process. And what I do is I take an alternate impression, and that fully gives me a customizable shape for the patient to wear. At this time, I also measure the iris size, and then take any sort of clinical notes for the socket dynamics that I can later incorporate into the prosthesis itself. Here's a picture of the custom tray that I start to use when fitting the prosthesis under anesthesia. So the next step is replicating the companion eye. The artificial eye is color matched for both the iris and the scleral tinting. Vasculature and pigmentation are copied through both visual inspection and photographic comparison. I always like to have the patient in the room when I'm doing these processes, because photography can change depending on the lighting, depending on the angle that you catch the patient on. So having the person there to kind of compare directly to is the best possible result. Gives you the best possible result. Also talk to parents about kind of pupil dilation in home or at school lighting environments. Reason being is that we only really see these patients in one lighting environment over the course of 1 or 2 days, And so getting the parents' feedback on this kind of thing allows you to make a better prosthesis when they go back home again. And then what I like to do at my office is actually paint a picture, something on the superior portion of the ocular prosthesis. And I normally try and get the kids' involvement in seeing what they want to have on there. It gives them something personal for themselves that they can kind of talk about it and have as well. So things like, a Minion or a Batman logo or something like that, something fun the patients can have at the very top of the prosthesis. You can't see it when they're wearing it, but they know it's there, and it helps when inserting the prosthesis or if the prosthesis is turned so that they can see directly where it has turned in the socket itself. Here's a couple more pictures. So go Toronto Raptors. Hopefully they do a better season, have a better season this year. So the next part of it is actually fitting the custom ocular prosthesis. So before we start with any of this, we always want to talk to the family and the child about exactly what the expectation is of what you're going to go through, how it feels, and then get any sort of answer any sort of questions that they have at the same time. I also believe in asking the child when they're ready to get going with it. If you can get them to say, I'm ready to go, or at least get them the opportunity to start to kind of accept that they're going to have to do it, I think it's a much better kind of team effort that way, as opposed to just saying, we have to do this right now, we're going to do it right now. And then I also like to have the parents involved in the process as well. So have them try it in the office as well. And then it really helps to build up the confidence for in-home maintenance. And it gives them a chance to kind of practice with having a specialist around them at the same time. And finally, when you're all finished, I believe in acknowledging success. So high five, saying great job, way to go, those type of kind of phrases, even if it's an infant where they don't necessarily understand you, the inflection of your voice, the kind of positivity that you express can help to build confidence with a child for completing a new task. As you can see from this picture, you have kids kind of 3-4 years old who you can just sit there calmly once they learn and just insert the prosthesis without any sort of kind of restraint or anything like that. And really that just comes from kind of practice, repetition, and a positive attitude towards the whole process. So we can get into some results here as well. So the primary goal of an ocular prosthesis is to give a patient confidence in their own appearance. And so the definition of a successful result is different for each individual. The one thing is perfection should never be the defined expectation. With a prosthesis, with our brains are really designed to find differences when we know they exist. That's why we do puzzles and games and stuff like that. And so we're not trying to fool someone who knows it's a prosthesis. So really what the goal should be is that if someone doesn't know it's a prosthesis, then they can't tell it's a prosthesis. And that's what I would say is a successful result in this endeavor. So here's some results for some children that I've seen in clinic. This little girl, she was about probably about 2 months post-op from this picture here. She's a little bit older now, hair's growing back, but she's very good with her prosthesis. She's supposed to be taken in and out, no problem at all. She was very good right away. Very bright, very kind of interested in what we were doing. This guy is also excellent result. He very cooperative as well. A little bit older now again as well. Really likes kind of riding his bike and playing games. Here's another guy, big into video games, has an older brother that's kind of got him into it. He was actually just in my office a couple of weeks ago, and we just remade him another prosthesis, and he's doing great. And finally, here's another kid that I saw. He actually moved back to the UK a couple of years ago. Haven't seen him for a while, but I wish him the best. Hope he's doing well. But he was a really fun child to have in my office. So now let's get on to the appointment schedule of the expectations of seeing the ocularist. So we believe that a biannual appointment basis is the best way to kind of keep the prosthesis fitting its very best. It allows us to avoid or detect any sort of complications before they escalate. Reason being is children can't always articulate discomfort or irritation. And so it's important to have the socket checked and how the prosthesis is fitting so that we can kind of cut off any sort of irritation points that the child isn't able to actually articulate to you. And during these appointments, the prosthesis can be augmented or adjusted to fit the socket as the child grows. So we constantly are refitting the kids as they go. And one of the other parts that we do during these appointments is, children blink, or people blink about 10,000 times a day. So just giving the prosthesis a reglazing or polish on a regular basis gives it its smoothest possible finish, allowing the lid to glide over with as little friction as possible. So now we're going to get into some socket complications. So anophthalmic socket infections are always a possibility with a prosthesis. Signs of infection include excess discharge, socket irritation or redness, or discomfort. Infections can be viral or bacterial. So what I always say to parents is if they ever see any sort of change in regular activity, so more discharge, irritation, rubbing, things like that, remove the prosthesis and take a look for any obvious signs of irritation or foreign material. If parents don't see anything, with the prosthesis out, have the child take a shower and let the water just run over their face. The inside of the socket doesn't need to be manually cleaned, but that water will run inside of the socket. If there is any sort of foreign debris or material, sand, eyelash, something like that, then it'll be cleared out from there. Then reinsert the prosthesis and just watch for a couple of days to see if there's any signs of improvement. Now we're looking for trends. So if baseline is discharge, gets worse. If we want to see it trying to trend back to normal, that's a good sign. If the socket continues to present with discharge or increases or has pain, then it's important to book an appointment with your healthcare team for assessment or culture to see why the socket is irritated. And then the thing we don't really like to talk about, that's always the possibility, is implant exposures. Luckily at SickKids, we've been very fortunate with the type of surgery that they're doing, the myoconjunctival approach. We don't really see this very often, if at all, but there's always the possibility, especially within the first year after surgery. So if there is any sort of bloody discharge, pain, or an obvious exposure on the implant, the healthcare team should be notified immediately. And so a small exposure, there's potential for a conjunctival graft or repair. Unfortunately, with larger exposures, the implant is probably going to have to be replaced to resolve the issue. So let's get into some tips, tools of the trade that we use. So regular at-home cleaning. So I believe that the prosthesis should be removed on a monthly basis for cleaning and inspection. Reason being, especially for kids, is that they can't always tell you how it feels. So having someone to kind of just on a regular basis take care of it is a good pattern to get into to make sure that there's no foreign material in and behind the prosthesis. So what we want to do when we're removing the child's prosthesis is find a time when there's no rush. You want the child in a positive mood, so don't do it just before bedtime or just before you go out of the house. Find a time that you have some time to actually do this and kind of make it positive as you can. So when you go to say to do it, you have to try and follow through. So if a child kind of cries or deflects and you relent, it's going to become a pattern and they'll keep on doing it, just like with anything else in their lives. Then again, with that being said, if you become frustrated, take 20 minutes, try again. And, this is not an easier process when you're flustered to do it. And then finally, if the prosthesis does happen to turn while it's in the socket, it doesn't need to be removed. Simply turn the prosthesis using a suction cup. But if it happens on a regular basis, book an appointment to see your ocularist and they can adjust it so it no longer rotates like that. So here's another couple things that we use in the office. So this is a suction cup on the top picture. This is what I use to insert or remove the prosthesis. It gives better kind of purchase of the prosthesis, especially with small children. And then I always have eye patches at the clinic as well, in case we have to build it up. And so I like to use these patterned ones. I think they're a lot more fun. I refer to them as a sticker as opposed to a patch. Kids like stickers. They get to choose which ones they want. It's a little more fun than just having the kind of generic skin tone based patches. So in conclusion, when a child's eye is enucleated, one of the primary questions a parent has is, what will my child look like? And I'm grateful to say that with successful surgery and a properly fitting prosthesis, the child will look like themselves again. When the custom ocular prosthesis is first inserted, the families often remark that they have their beautiful baby back again. This is one step in the healing journey and one that I'm very privileged to be part of. And so I believe that an ocularist is an integral part to the patient's healthcare team. And it's also a resource for the patients and the family and the healthcare team to use for their entire lifetime. I just want to say thank you again for letting me speak at this conference. I found it very collaborative and enjoyable last year, and I'm very excited to see it again this year. So thank you very much.
Thank you so much, Matthew. That was very informative, and we really appreciate it. So I'm going to touch on something that Matthew spoke about, and that is the role of having, not the role, but having an implant. Before I do that, I wanted to introduce everyone. Some of you guys know Ellie, the elephant. This is Ellie, and she is an elephant from Germany who's also decked out for Hawaii with the pineapple shades and hule. And she comes from the CACS organization, and Sandra is going to put the link in our chat for anyone who's interested in ordering an Ellie. And Ellie, the elephants are free to anyone. You just have to send an email to our friend Monica, who might be on here. And Ellie has a removable eye. And so this is also a wonderful tool for families and for parents and for ocularists. And Ellie's left eye comes out. And then you can practice putting Ellie's eye back in as well. And so that's a really good teachable, hard to get Ellie's eye back in here, tool for families, parents, and ocularists. So again, Ellie is free to anyone who requests an Ellie. So as Matthew mentioned, children have implants after their eye is enucleated, and something that adult survivors sometimes run into, especially ones who receive radiation, is the migration of an implant that had been placed as a baby. I know many survivors have run into this, and I myself have as well. And so I just wanted to share the route that I took in hopes that it might be able to help some other survivors. So my silicone implant was 14 milligrams, and it migrated completely postnasally up against the sinus, which was causing immense pain. So in 2014, we removed that implant and filled it in with a dermis fat graft. So the surgeon took some fat, made just a slice in my stomach, scooped out some fat, and then encased it in skin from my stomach as well, and filled in the hole where the implant had been. And it took, but it also needed to be kind of plumped up or filled in a few years later with adipose stem cells. So stem cells that also came from my stomach to kind of give it better blood flow and to help it survive. And it is doing very well back in there. But the ocularist really plays a big role in a dermis fat graft or in removing an implant and having another implant put in, because the shape of my prosthesis completely changed once that implant was out. So as Matthew mentioned, your ocularist is really part of your team. And I see Stephen Haddad here in Los Angeles, who a lot of you know, and I know Matthew knows as well. And so really keeping your ocularist, as you know, yes, it's painful. I don't enjoy having my eye taken out, but I enjoy going to see my ocularist because I love their team and they've become part of the family. So really being on the same page and having, you know, them as part of your team. And it took a lot of different fittings after the dermis fat graft had been placed. I think I had to wear a patch, or as Matthew called it, a sticker, for about 3 or 4 months. And then we were able to fit a new prosthetic eye. And I've since had additional stem cell implants into the dermis fat graft to just really help it live and survive. And so that's been something that I have found that has really worked, especially in a socket that was heavily radiated. So I hope that might help. And now we're going to turn it over to Camille Loyer, who is an ocularist in Melbourne, Australia. So welcome, Camille.
Hi, everyone. My name's Camille. I'm an ocularist from Melbourne, Australia. I have been working with my dad, Patrick, for the last 8 years, and we make and fit custom artificial eyes for adults and children that we see. I've been invited to speak to you all today about my experience making and fitting artificial eyes for children and how we use playtime as part of that process to make it as positive an experience for the kids as possible. Sometimes playtime includes my puppy Zazu, and before him it was Milu, so I'll speak about them a little bit too. Before I start, I just wanted to mention, for those of you who have a vision impairment, almost all of the photos in my slides were taken in our consulting room. We work from my parents' home, which is a 1915 house. The consulting room has a dark red carpet, light blue walls. There's a big fireplace, which has baskets and boxes of toys in front of it, and a big chair on the opposite side of the room, which is a bit like a dentist barber chair. And that looks out over the garden through a really nice big window. And we have lots of photos on the walls as well of different patients that we've seen. The photos aren't really in any particular order. They just give you a bit of an idea of what an appointment with a child looks like at our office. Most, but not all, of the children in the photos have had a retinoblastoma diagnosis. Some have other eye conditions, and obviously I have been given permission from the parents to use these photos. As an ocularist, our role is to help rehabilitate the eye socket after the removal of an eye, and in particular when working with children, to gradually encourage the natural development of the eye socket and bony orbit. There is a lot of work that goes into making an aesthetically pleasing and comfortable prosthesis, and working with children, we try and disguise as much of that as possible as we can with playtime and having fun. Our aim is that the appointment is enjoyable and that the child looks forward to coming to see us. Half of the time I find myself lying on the ground or building trains or making children laugh just to get a good look at where the pupil needs to go. We are very fortunate to work from my parents' home. I think especially when working with children, a space that feels non-clinical helps to differentiate this appointment from others that they might have had. We want the kids to feel like they're coming to visit us in our home for a play and a visit rather than anything else. I love it when parents tell us that their child is excited to visit Camille and Patrick's house, or that they were talking about something they played with last time they came, or maybe asking about Zazu and if they'll get to see him next time they come. They're the things that I want them to associate with their visits to us. Speaking of who, Zazu's just come over for a treat. All right, so here's our consulting room and a little boy who's come to visit us. That's Milu there with one of the little boys. That's Patrick and myself with some kids that we see. And that's a little bit what our room looks like when we've got kids coming to visit. Thanks, Sandra. So the things that I want kids to associate when they come to visit us is seeing the puppy, having a play, getting a treat, having a nice time. Before seeing the ocularist, there has obviously been a trauma, and in the case of retinoblastoma, there might have been a really quick enucleation after diagnosis, or maybe treatment for a long period of time before the eye is eventually removed. And sometimes when a child comes to see us for their prosthesis, they're still having treatment on their other eye. The time before seeing us as the ocularist has usually been very traumatic. And after many hospital visits and the child's autonomy being somewhat taken away from them, the last thing they want to do is to meet another adult who wants to touch their eye. And even if children are excited about coming to see us and get their new eye, there is still some hesitancy to begin with. As I mentioned earlier, we try to disguise as much of our work as possible in playtime. Checking the centering of the pupil or looking at the iris color can be done while entertaining or playing with a child. This limits how much you're asking of them and hopefully keeps their attention for long enough to make an aesthetically pleasing and comfortable prosthesis. It also means when we are doing the more challenging parts of an appointment, removing the prosthesis or putting it back in, that we haven't asked too much of the child already. My dad, Patrick, has always said to new families coming for the first time that the most important thing is the child feeling comfortable and wanting to visit us. The ability to do the work will follow when you have earned their trust and they're not scared of coming. We want them to feel like we are their friends as well as their ocularist. No matter what age, we try to explain to the child what we need to do and what they will need to do to help us make their eye, which Matthew mentioned earlier. Speaking to the child and not just to the parents is so important. I find that most children really want to help and will really try hard, and it's usually because they are scared that they're not able to do what's required of them, but it's always obvious they really want to help. Giving the child back some control of what's happening to their body is so important. And even if they aren't initially able to do what you're asking of them, we try to make it a space where they are in charge and making their own decisions as much as possible. Eventually, we will be celebrating milestones of not needing to be held or being able to remove the prosthesis on their own or not needing to go to the hospital for an anaesthetic to have the impression done. We try to work at the pace of each individual child without asking too much of them. And I want to be celebrating tiny wins rather than asking too much and setting up a failure. Having playtime during the appointment is obviously fun, but it can also be a time for praising and encouraging a child. By pausing the work and joining in on playtime, you're able to build a rapport. Having some time in the appointment where we're just playing allows the opportunity for the child to succeed with something unrelated to their eye. I think this helps to balance out the times of anxiety or when they're not able to do something that we needed them to in relation to their prosthesis. I want the child to feel like they've done a great job, whether that was allowing me to remove the prosthesis without crying, or they built a really cool train track. Both are great. We have a few children who've really benefited from visits to us without us even touching the prosthesis. They come for a play, they see the puppy, they have a chocolate, get some stickers, and leave after having a really positive experience. I don't know what it is about stickers, but kids love stickers. Sometimes including siblings in those visits can be really beneficial for the whole family. One of our mums was telling me the other day that by coming to appointments with his little brother, who's our client, her oldest son has become part of his support team and is able to be encouraging and really helpful when something needs to be done for the prosthesis, whether that's putting in eye drops or needing to remove the prosthesis to clean it. He also doesn't worry about his brother coming for appointments because he's met us, he knows that we're not going to hurt his brother, and he's been included in the fun time, I guess. He's able to help his brother better, and I think it's been a really positive experience for the whole family. The whole family is affected when there's been a diagnosis of retinoblastoma, and making sure that the other children in the family are okay and not worried is really important. So bringing them along to an appointment to have a play and have a treat and see the puppies is really great. Even for children who don't require those regular visits and playtime so much, I still encourage parents to bring their children in for a polish and a play in between fitting appointments, so that every time they're coming is not a big appointment and is not too demanding, and that they don't forget us and we don't become strangers, and also that positive experiences are remembered. It can take time, but eventually when a good relationship is formed and trust has been earned, working on the prosthesis gets easier. My dog must have known that I was about to start talking about dogs. He's come over for his treat. With my dad working from home, my childhood pet Milne became a bit of an unofficial therapy dog. Given the opportunity, he would wander down to the consulting room for a pat and became an important part of working with children. And when I started 8 years ago working with Dad, I would often bring Milne down to the consulting room and would see how quickly he would have a calming influence on the space. After he passed away last year, I got a new puppy, Zazu, and he's very happily taken on the role. Animals can be very soothing in a stressful environment or when working with children. And for those who like dogs, they can be very therapeutic. Zazu isn't really well trained enough to be a therapy dog just yet, but he's still able to diffuse a stressful situation or help calm down a child after you've touched their eye. And sometimes a little surprise visit to the consulting room can be a really nice change of pace for everybody. Zazu and Milu before him, unlike us as the ocularists or parents, is not asking anything of the child. When we bring him down for a visit, if the child is upset, he can have an interaction with the child that we're not able to. It's well documented that patting an animal can lower blood pressure and in turn reduces stress and anxiety. I think that they really have helped to make the environment feel safe, as well as it being just fun to have a puppy around. I feel fortunate to be working from my parents' home where I can bring my dog to work each day. There are adult patients who still ask about Milu when they call to make an appointment, and he obviously made a big difference and to their experience when they came as a child. And it reminds me that he helped to create a non-clinical kind of space for a child when they're coming to visit. So that's pretty cool. We had one little girl who used to write letters to Milu and would get really excited about coming to see us, or probably more seeing him. And for several years, she had a really hard time letting anyone touch her eye. But with Milu around, he made it a positive experience for her. And in time, she made a huge amount of progress in becoming independent with her prosthesis. And I think Milu had a really big part to that. I think that a positive and empowering experience that a child has with the visit to their ocularist can help them to feel confident when when wearing a prosthesis, and helps them to tackle any challenges that might arise. A child who wears an artificial eye will have many visits with the ocularist, both as a child and into adulthood. And I hope that we have and continue to make it a safe and fun place when our clients are young, and that visiting the ocularist isn't a dreaded appointment or avoided like I avoid going to the dentist. Thanks everyone. I hope that by listening to these talks that we've shown you how much as the ocularist we really care about the people that are coming to see us. And while our main aim is to make a beautiful, comfortable prosthesis, we really strive to assist in the healing of a child and their family after the diagnosis of retinoblastoma. Thanks.
Okay, Camille, that was just amazing. And yeah, it was great for me to see all my little friends that I've looked after for a long time. And I tell you what, I've only ever seen ocular prosthetics from the perspective of an anaesthetized child. And wow, I tell you, I learned so much at these meetings, and I didn't expect to learn so much about what goes on in my own backyard. Camille, do you want to put your camera back on? Oh, you have put your camera back on. Thank you. Okay, so we've got one question, but folks, put your questions in the Q&A, and we've got plenty of time before we go to the breakout networking session. So please put those questions in the Q&A, but the first one would be for either of you, Matthew. Also Matthew, your talk was amazing as well. Thank you very much. I think it's always really important that even us as clinicians and parents and survivors sort of appreciate the nuances and all the thought that actually goes into ocular prosthetics and socket rehab. So the question is, any ways to deal with anxiety surrounding taking your own prosthesis out as a young adult in their early 20s? Is totally fine with other people. So I presume they're talking about their survivor at home, with other people doing it for them, but cannot seem to get over the mental block of taking it out themselves, and it is a cause of much distress. Matthew, do you want to go first?
Yeah, sure. So it's actually pretty common for a lot of people that first step of learning how to do it themselves. What I always think, some of the key ways that I like to teach someone how to do it is to kind of break it down into smaller steps. So first start touching the prosthesis with your finger, or just getting used to kind of the sensation of having some pressure put on it, and let kind of you get comfortable with that step. Then using a suction cup, doing the same type of thing, just kind of touching it and just getting that kind of that feel for it. And then start to remove it, feel the pressure of removing it, and really just kind of break it down into small individual processes until you kind of get the full experience going. And really it's just practice and time is the best way to kind of learn how to do this type of thing.
I'll just add, I think some people really benefit from using a mirror, and it's kind of automatic to try and do it in front of a mirror, but sometimes seeing the eye being removed in the mirror can be quite confronting. And so, as Matthew said, knowing all the little steps involved in taking out the prosthesis, if you can get your head around that, then you can try and do it without a mirror, and that might be less confronting for you, might be something worth trying.
Great. Okay, there's another question. Thank you. Okay, so this is from David. How would you describe excess discharge? My child's 2 years, 10 months old, and the eye gets considerable discharge but has no infection. We only clean it 3 to 4 times a day due to how traumatic it is. We use drops at each cleaning, which helps, but seems it's a constant battle. Additionally, we're advised not to take the prosthetic out. Matthew.
So when I was talking about excess discharge, I mean anything. So if the baseline is always kind of cleaning it multiple times a day, that is kind of more than what the expectation would be. It's hard to say when within the first year or so, there's a lot of variation. So if the child is still in that first kind of year, then there could be some post-traumatic healing going on and some immune response with the cleaning. So that it would explain why it's a little bit higher at that stage. If it's later on, potential issues are kind of a prosthesis that needs to kind of be refit, or maybe just general hygiene at home. It's hard to say what it is without seeing the child itself, but trying to kind of knock things off the list was always helpful. So go and see your ocularist, see if there's a refit potential for it. Other things that you can do at home are humidifier if it's fairly dry in the room, or if the eye doesn't close very well. Some humidification in the room itself can help create a little bit better moisture within the socket, and that tear balance can be a bit better. And then drops as well. Any sort of way to balance out the tear production in the socket can help.
Camille, you got anything to add?
No, I think Matthew's definitely covered it. It sounds to me like maybe a fitting issue, because that's a lot of discharge. So if you're using lubricants and there's still that much discharge, maybe a polish is needed or a little adjustment of the prosthesis.
Mm-hmm. Okay. Anyone else that would like to ask a question? Now that we've got time for lots of questions, it's all gone silent. Well, while we wait, I might ask a question myself then. I've had experience with survivors who, as adults, are unable to cope with anyone seeing them without their prosthetic eye, and that's been a barrier to receiving the ocular prosthetic care and follow-up that they actually need. What can you say to provide some insight into what we can do there?
From my thing, it's really just kind of gaining a level of trust with the ocularist. I mean, everyone's comfort level without the prosthesis is a very kind of personal thing. And so building up a kind of a rapport with the ocularist or the specialist is really important. And then for the ocularist as well, on their side, is when someone comes to see them, allowing them to the time that it takes to kind of get them comfortable with it, and depending on how they feel comfortable. Sometimes some of my patients want the eye back in right away as soon as it's done. If you're either going to go, they don't want to leave the room when the prosthesis is out. Say if you're going to do like a buildup, it's going to take some time. They just want to stay where they are. And kind of respecting those people's boundaries of what they're comfortable with is really, really important. And it's you know, it's one of those things that we all have kind of our insecurities in our lives. And so, you know, respecting those insecurities, allowing people to kind of be themselves, and really, and both at the same time trying to help them get comfortable with you as a specialist or ocularist, so that they can kind of come and see you to get the care that they actually need.
Cammy?
I was going to jump in if I could.
Oh, sorry.
Marissa. And it's Ellie as well. I think this is a question that is very, very relevant, especially, you know, since the majority of people that have prosthetic eyes because of retinoblastoma have had them since they were very little and don't remember not having one, as opposed to someone who receives an injury later in life. And I was definitely that exact same person. I didn't even want to go into the waiting room with a patch over my eye because A, it was uncomfortable not having an eye in there, and B, oh my gosh, people are going to look at me. Well, I'm in an ocularist office, so everyone that's here is there because their family member has a prosthetic eye, or maybe even two. And so I think what Matthew said is absolutely so important, and just being friends and just being, you know, teammates with your ocularist is so important. But I also think that having, you know, discourse at home and talking about, which is something that Morgan discussed in Child Life and something that we'll address tomorrow in our mental health session, is that, you know, I know Maria Isabel Espinosa, who might be on, but she's a California mom, and her little boy Angel has this enormous extended family around him, and she's discussed, you know, talking to his cousins about his prosthetic eye. He's about 6 or 7 now, but just, you know, starting to have these conversations when you're really young about your prosthetic eye or your special eye, or as Matthew said, you know, having Spider-Man on your eye. I personally have a little penguin on the inside of my eye because I love penguins. And so starting those conversations, and this, I think, David, was really important for you, starting these conversations age appropriately with the children so that they grow up having discourse about, I have a special eye, or I have a prosthetic eye, and sometimes it comes out, or sometimes I go see my friend Matthew or my friend Cammy, and I get to play with Cammy's puppy, and then Cammy takes a look at my special eye. And so that it's not something that they don't talk about, so that by the time they're teenager, young adult, it's just a natural part of the conversation. And then it becomes, you know, natural part of conversation with friends. Or, you know, if you do have to wear a patch for an extended amount of time, the first time I had to wear a patch for 3 to 4 months, I didn't have the choice whether I liked it or not. I had an implant surgery, and there was a patch for 3 to 4 months. And it was amazing how quickly I got used to it. And if people stare, people point, you know, I got real cool special patches. I put like USC glitter tattoos over the patch when I went to USC football games, and Denver Bronco stickers, and I just made it fun. And it's also, once you get to adulthood or teenagers, it's a way to educate people. So people ask you, why are you wearing an eye patch? You know, it's an opportunity to educate them so that they won't point or ask questions in the future. So it's kind of long-winded, sorry.
Cool. Cammy, have you got anything more you wanted to add?
I was just thinking about a client who's in her 30s who we saw last week, actually, and she had microphthalmia and used to see my dad when she was younger. And then after about age 15, she didn't want to come and was kind of lost to follow up, and came back with her mum at age 28, I think. And she didn't want anybody to see her without her prosthesis in. She had sunglasses on during the appointment, and she wanted us to make her another prosthesis that was exactly the same as her last one, because she didn't want anyone to see the difference, even though there had been a lot of changes to her other eye, and we needed to really change colors and try and make it a little bit bigger, and there was other things we wanted to do, but we had to really just take that process so slowly with her so that she could come to terms with the prosthesis looking a little bit different. And I think the big difference for her has been coming multiple times and being able to share what gives her anxiety, and us earning her trust so that now we can make a prosthesis that's what we feel it needs to look like, and she's comfortable with her change in appearance when she comes to get a new prosthesis. But that's taken a lot of visits, and I just remember, you know, the first time she was happy for me to see her eye socket without sunglasses on, and nothing had really happened other than seeing us, chatting to us, not having to do much in the appointment other than a polish. And eventually she feels comfortable with us to do the right thing by her. So yeah, but as Marissa was saying, having those conversations with children is so important because it really helps to avoid those situations later on.
Cool. Okay. I think we're getting to the end of this session, and I might get Camille, no, not Camille, Marissa. Marissa, do you want to jump back on and introduce what happens next with this networking? Because heaven forbid should I touch anything technical.
I sure will. Well, thank you so much to Matthew, and thank you to Camille for being part of our All About Prosthetic Eyes session. And we had some really great questions. So thank you. And we hope you guys will both be able to stay on for our networking session, as we might have some more questions.